In the spirit of thinking globally and acting locally, I went down to the Hawaii County Department of Health to find out just how deadly this global pandemic is on our island. The staff there couldn't answer my questions about the dates and number of fatalities attributed to COVID-19. They referred me to the state COVID website, hawaiicovid19.com. From there, I was instructed to go to the data dashboard. This took me to the Hawaii Emergency Management Agency website. Here I could get an overview of the COVID-related deaths in Hawaii County since the pandemic began. The data dashboard has a nice graph showing all the fatalities that have occurred in Hawaii County since the pandemic began. Each bar represents a week that COVID deaths were reported. If you click on the top of each bar, it displays the date and number of deaths that week. I did all this on my phone and found that I had to click on each bar 20 to 50 times before the data popped up. So here's what it all looks like. There were 15 weeks over the course of the pandemic that a total of 53 deaths were reported. When I did some digging online, I learned that Hawaii County's first COVID-related death occurred on August 28th in 2020 at the Yukio Okutsu Veterans Home in Hilo. By October 2nd, there were 29 COVID-related deaths on the Big Island. 27 of them had occurred at the Yukio Okutsu Veterans Home in Hilo. Interestingly, the same day that the outbreak at the Veterans Home claimed its 27th and last life, another outbreak at the Life Care Center nursing home in Hilo took its first life. That outbreak lasted a little over 3 weeks and claimed 10 lives. By the end of October, there were 48 COVID-related deaths on the Big Island. 37 of them occurred in these two nursing home outbreaks. Of course, all of these COVID deaths were accompanied by multiple comorbidities. If we remove these nursing home deaths from the count, then there have been 16 COVID-related deaths in the community of Hawaii County since this pandemic began. There were 2 in September, 9 in October, 2 in November, 2 in December, and 1 in January. Our last COVID-related death was on January 22nd, 2021. That is nearly 4 months ago. 4 months without a single death. Of the 14 months of government mandates, there have been 5 consecutive months with deaths in the community. Other than October, there haven't been more than 2 deaths in any month. And again, there have not been any deaths in the past 4 months. But wait, there's more. A primary concern throughout this pandemic is the enormous strain it puts on our healthcare system and its limited resources. The Hawaii Emergency Management Agency's data dashboard gives us insight into this as well. To date, it tells us there have been over 200,000 COVID tests performed on Big Island. Of these more than 200,000 tests, only 2,905 were positive. Of those 2,905 positive cases, only 132 people have been hospitalized throughout this entire pandemic. In the month of September, the number of people in Hawaii County hospitalized due to COVID peaked at 23 people. Since the last COVID-related death on January 22nd, Hawaii County has averaged 2 people staying in the hospital per day, with a sudden peak of 8 people in the county's hospitals on April 18th. Some people might say that these low numbers are all due to distancing and masking. I ask you though, how long do you go without any stress on the medical system and any threat to human mortality before you're willing to declare the emergency over?